Welcome to the progesterone and oil injection video. We're going to show you how to do 1 day's dose of the progesterone intramuscular injection. This injection is in an oil-based solution, so this is an oil to be kept out on the counter just at room temperature. We don't want this to be kept cold. It's just thinner and easier to work with at room temp. This is a multi-dose vial, so you'll get several days doses out of this, and we do send in refills should you need it. You contact the pharmacy directly to get more. So to gather everything that we need, we have our progesterone and oil vial, and you need your needle and syringes. So I have a 3 cc or 3 ml syringe. This one comes with a 22 gauge 1.5 inch needle tip attached. Your pharmacy may have sent you just this syringe part with the needle separate. Either way is absolutely fine. You're also going to need a separate needle tip to draw up the oil. So this is a larger 18 gauge 1.5 inch needle, and it's only used to withdraw the oil from the vial just because it's easier to get it out. You will never be injecting with this needle tip. We're going to use our alcohol swabs just to cleanse the skin, and then our red sharps container to discard afterwards. To administer your progesterone and oil injection, we're going to show you how to prepare the oil and use the 2 different needles to draw up and inject. So my progesterone vial will have a hard plastic cap, which you need to remove prior to injecting. I'm always going to take an alcohol swab and swipe the top of the vial before every use. I want to prep my needle syringes, so I'm going to open up my package. This needle syringe is our 3 cc syringe, and it's got my 22 gauge 1.5 inch needle tip attached. This is our injection needle, so this is not used to draw the progesterone out. I'm going to remove it. So I'm just twisting. Just like you're screwing the lid off a jar, it comes out of the teeth. So my needle tip, I'm just gonna tuck right into my wrappings to keep it clean. Then I'm gonna put my larger 18 gauge 1.5 inch needle tip on. So I'm peeling this back. I'm going to push and twist. Really make sure that it's good and tight on here. And now my larger needle tip is attached. So 18 gauge, I'm gonna open this up, and I'm going to withdraw my oil. So I've already wiped the top with the alcohol swab. I'm going to just insert this into the middle of the rubber stopper, and I'm going to invert the vial so that I can draw this out. So we're going to be pulling back the plunger here to our desired dose, and you're going to be confirming with your care team exactly how many milliliters you'll be drawing up and administering. So we're making sure that we're pulling back and the needle tip is below the level of the oil. And this is a thick oil, so you may need to work with it a little bit and pull it out to your desired dose. What we're looking for is for the top of the black plunger that is touching the oil is sitting at your desired dose hash mark. So once you've measured out your amount, you'll remove this needle. We're gonna very carefully cap this on the tabletop. You're gonna give it a twist. We can throw this in our red sharps container. And then we're going to screw back on our injection size needle. So the 22 gauge 1.5 inch long needle tip, push and twist, really get in there and make sure that it's good and tight. And now this is ready for the injection. We're going to show you how to administer your intramuscular progesterone and oil injection. This is going in probably a new injection site for you. This is an intramuscular site, and our preferred site is the upper outer quadrant of the buttock. So imagining one butt cheek divided into 4 quadrants, we're choosing that upper outer corner, and we're almost imagining if you're wearing a pair of jeans, that upper outer corner of your pocket, right around there is what we're aiming for. So a little farther and higher out than you probably think. Different from subcutaneous injection, with this, we're gonna be spreading the skin flat instead of pinching, and we're definitely gonna be going in at a 90-degree angle this time. So preferred method will be to cleanse the skin. We're gonna be choosing our gluteal or our buttock site, so cleaning that skin. And you're going to be alternating injections. So we're on this every day. We can go from right to left and just alternate those sides. Cleaning that, and we've drawn up our dose. We're going to be holding this at the base like a pen, like a dart, removing the cap here. And then with this, we're just going to be spreading that skin flat and going directly in, because we want to make sure that this medication is absorbed into the muscle tissue, slow release throughout the day. So 1, 2, 3, we're pushing this all the way in. I don't want to see any needle tip. Best practice is to anchor this syringe, pull back slightly to make sure that you don't see any blood return, any red show up inside of this oil. If you did, you would stop, take the needle out, start over, and draw up a fresh batch of oil with a new syringe. It's extremely rare, but we do like you to check. If I don't see any red, I'm gonna go ahead and push this down all the way, nice and slow. Once it's pushed, and it is again a thick oil, so you just push slow, and once it's all administered, I take the needle tip out, I take it and I put it inside my sharps container, and then I wanna massage the area and really get that oil worked into the skin, walk around, get moving. That muscle is gonna get sore. So you're gonna put a heating pad on it. That's absolutely safe. Tylenol is typically safe to take if that's something that you're allowed to take, and really just working that into the muscle because it can get lumpy and bumpy. So the more massage you do and the more movement you do after the injection, the better.